what time it is. Marvin Devine, Hoover, Axel, and you know how we do. Yeah, I got the juice. Big game cool, make them look like cool. Always play it cool, that's the biggest rule. Forget what they doing, keep on doing. I've been making loot since like 22. Ask me how I made it right here in the booth. I'm always pursued cause of what I pursue. That's greatness, yeah, I gotta make it, I got things to lose. Boy, wanna get in my crew, but you can't get in my crew. Me, Axel, and Hoover, way too fireable. When this joint drop, better call the troops. And when you hear the drop, better raise the roof. Better raise the roof. You already know what happens when we link up. Let's go. Yeah, I got
Hello and welcome to Kidney Hub East Africa, your trusted platform for kidney health education, awareness, and inspiration. I'm Steve, the Kidney Nurse, and I'm so glad you could join us today. Also, I'm honored to be joined by my amazing co-host, Moses Kennedy. Y'all know him. Also known as the Kidney Ambassador, and Renal Nurse Specialist, Tabitha Matekwa. Now, she's running late, so we expected to see her. Today, we are excited to welcome a very special guest, Nephrology Nurse Alice Tu. We are looking forward to an enlightening conversation about kidney care, patient support, and the vital role of nephrology nursing in improving lives. Now, check this out before I move any further. This is crazy because me and Alice met 3 years ago. When I first came on TikTok, and I was like just searching for different people. I seen her videos, and she was videotaping the dialysis machines in the center where she was at. And we connected and everything. And then I lost my page. But it's just crazy how this comes back in full circle with Brother Moses reaching out to Alice. And he's in Kenya just like Alice, and they 3 hours apart. And I'm here in the U.S. So you see how this works? This is what it's about when it comes to kidney disease education, whether it's in the United States, whether it's in East Africa, or whether it's somewhere else in the world. The education has to continue. But whether you're a patient, a caregiver, health professional, or simply passionate about kidney wellness, we're glad you're here. So sit back, stay tuned, let's learn, share, and grow together on Kidney Hub East Africa. Now, you know, before we bring out our co-host and guests, I got to go over our medical disclaimer because I don't want people coming on here like, you ain't no doctor. I never claimed to be. But let me say this. The information that's broadcast on Kidney Hub East Africa is provided for educational and informational purposes only. And is not, and let me repeat that, and is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. Now, with that out the way, I see we only have one of our co-hosts available. So let's bring on I ain't gonna say my favorite co-host because we had two co-hosts, but let's bring on my friend that's been doing this with me for the last 3 to 4 years, all the way from Nairobi, Kenya, or let me just say Kisumu. I just try to put Nairobi so you can say, okay, he's close to Nairobi, the capital. You know, a lot of people do that with DC. They say, I'm from PG County, and say, you know, try to claim DC. But no, let's bring on our brother, Moses Kennedy, also known as the Kidney Ambassador. Hey, Brother Moses.
Yes, Brother Steve.
How you doing?
I'm good. It's a pleasure once again.
Good, good. Let me say hello to Anna. How you doing, Anna? Thank you for coming to the show and watching. I appreciate you. Brother Moses, it looked like we don't have Tabitha with us today, so I hope everything is going well.
I've just called her. Just call her. She says she's getting home, then just joining.
Okay.
Yeah,
so
in a
fine.
few
We
minutes.
can still move on with the show. Now let's bring on our wonderful guest and give her the VIP intro. Hey, Alice, welcome.
Hi, Steve and Moses. How are you? Good to see you.
Oh, man, it's good to see you. Welcome to the show. We are truly honored to have you with us today.
Thank you so much. I'm honored.
Huh?
I'm truly honored to be here this evening.
Okay, let's move you over in the middle. There we go. And let me say hello to Latasha. Thank you, Latasha, for coming in and support the show. Always appreciate your unwavering support. That's Latasha Garner from from Facebook. Thank you for coming. So what's going on, Alice? It's been a while since we reconnected.
Yeah, Steve, thank you. We connected through TikTok platforms. Mm-hmm. I post a lot of videos in my unit, working in a dialysis unit. And that's, I think, that's where we connected, Steve.
Yes, we did.
Yeah, we did. And I also been watching your videos, wonderful videos, teachings.
Oh,
And
thank
how
you.
and how you do things there in the US. And quite amazing that you really educate a lot of patients and do a lot of work in the kidney care.
I try my
appreciate you
best,
for that.
Alice.
Yeah.
Yeah, I try my best. So, Alice, Brother Moses, how you doing?
I'm great.
Mm-hmm.
So much great. Although it was a scorching sun today, but all is
Right.
well. Yeah,
Right.
yeah.
Before I move on to ask Alice some questions, I know Sister Tabitha is running. Okay, here she come right now. So let's give her the co-host welcome like we do everyone else. So we're going to bring on renal nurse specialist Tabitha Matekwa. Hey, Tabitha, welcome.
Hi. Thank you.
Hi.
Hi. Nice to see you. Yeah,
Nice
hi
to see you.
Moses.
So this is interesting. We have 3 nurses here, 2 from Kenya, 1 from the US. Now, Tabitha and Alice, do y'all know each other, or have y'all ever met or crossed paths working in kidney dialysis in Kenya?
Thank you.
Mostly maybe we met mostly in the conference. Mostly we met in the mostly we have met in the conference.
Oh, so y'all have met each other before?
Somehow, but we've not interacted much.
Uh-huh.
Yeah.
Wow. So let me ask you this. Like you said, you interacted. Up until this point, did you ever think that you would interact again in a program such as this?
Not really. It is we thank Moses and you, Steve, for bringing us close together. Yeah, thank you.
So what about you, Alice? I mean, I know we met on TikTok, and I don't think if I ever mentioned to you that I do an international show each Sunday with a gentleman that is a kidney patient in Kenya. Would you ever thought in your wildest dreams that you would be here today talking about kidney disease education?
Thank you, Steve. This is really amazing. I couldn't think that one day I'll be in this international show and sharing about kidney. And I think the world is so small. The world is so small. I have seen Tabitha. She's familiar, but we've never interacted. And I'm happy to be here today. And I'm happy to see you all.
Thank you.
Okay. Yeah. Thank you, Alice. Serious. Good to have you here today. And as I mentioned to you, prior to the show, that, and I talked with Brother Moses, we would like to, have you come back on from time to time, or when your schedule allows, to also add your thoughts and wisdom to any topic that we discuss pertaining to kidney education in East Africa. Now, I know Nairobi and Nakuru. I hope I said that right.
Yeah.
About 3 hours away. I don't know. How far is that away from Nairobi?
It's like 2.5 hours.
Okay, so a little bit less than from where Moses lived. But
yes,
either way, I'm sure the care of kidney disease could differ, or the education may, be pretty much fragmented. So we hope to have many more professionals on from Kenya, and to spread the education and information to help Kenyans who, not just Kenyans, but people in East Africa that watch this show, to help bring education and information for a quality life in spite of what they may have to go through with kidney dialysis. Now, Alice, let me ask you, as I mentioned to you before we came on, you could have been any nurse out there, because we know in nursing professional, we got different nursing disciplines. But what inspired you to become a nephrology nurse, and what has kept you passionate about renal care for over 10 years?
Yeah, thank you, Steve. When I did nursing, I didn't know that one day I will become a nephrology nurse. I was first posted in a general nursing ward, and I worked there for some time. Then one day I received a call, and I was told that I was among those selected to go and be sponsored by the government to do nephrology. That time, even I didn't know what is nephrology in the first place. I didn't know what is renal nursing. And I just went with my other two nurses. Yeah, we were sponsored. We were 3 of us. So we went and trained. That was the first time I saw the blood rolling. That was the first time I knew what is kidney disease and all that pertaining dialysis, peritoneal dialysis, and everything. I became just passionate about it, and I liked it. Yeah, and that is it. And I moved on like that until today. Yeah.
Okay, Brother Moses.
Alice.
Yes, Moses.
The renal unit at Nakuru County Teaching and Referral Hospital was established in 2009. What was it like being part of the team that helped build and grow dialysis services from the beginning?
It was just amazing. It was just amazing. While we were studying in school, that was at Kenyatta National Hospital, we used to see patients coming all the way from very far end, like Mombasa, that is Kisumu, around 5 hours on the road coming to the National Hospital in Nairobi. And the time we completed school and we were to start our own, it was just an amazing experience, because now these patients who are going long distances to get services in Nairobi were able to get right there in our county. That was really inspiring. And we grown up, we were able to save many lives, many lives, which were lost during on the way, or even they couldn't even go to the hospital. They just become sick and stay at home. That was really amazing team to start the dialysis center in Nakuru. And I want to say thank you for the team that was there at that time, and they are still here even today. I know they are in the show. They are watching.
Wait a minute. Wait a minute. You said people had to travel 5 hours?
Yes.
To get care?
Yes, that is, Steve. You find that somebody has traveled for 7 hours to Nairobi. Queue. You can't go and get the machine ready for you there. You go and queue, do a queue for like another 3 hours. Then now you get the machine. Then now you dialyze. Then now you travel home, stay for those 2-3 days there, you come back again to Nairobi. Yeah, it was really, really bad. It was really, really bad.
Wow, wow. Okay, Tabitha. Wow. Oh, Tabitha, it's on you. Can you hear us, Tabitha?
Can you hear us?
You're on mute. Hi, Tabitha, you're on mute. Brother Moses, I don't think she can hear us.
Yes, let me just try reach her.
Unmute.
You, Tabitha?
Yeah, I can hear you.
All right.
Yeah.
Yes.
All right, the question's on you. Question 3.
Thank you so much, my colleague. And thank you so much. Whatever you are saying is true. When I started working in the renal unit, we had very few renal units, and our patient wait. You can hear?
Yes.
Yeah.
Yes.
Okay. Our patient would really wait like almost the whole night and a day before they could dialyze. Sometimes they would dialyze once in 10 days because the machines were few. And now other units coming really came like a very big blessing. And we are really grateful for the catchment in your area in Nakuru. It is really doing a good job.
Thank you.
So, you can hear Steve?
Yes.
So, as a renal nurse, how do you balance technical demand? As a renal nurse, how do you balance technical demands of dialysis care with compassion and emotional support for your patients? You got me? Can I repeat?
Repeat that.
As a renal nurse, how do you balance technical demand of dialysis care with compassion and emotional support for your kidney patients? How do you balance?
Alice, did you hear Tabitha?
Yeah, she was directing the question to Steve.
No, she's talking to you.
Sorry.
Oh, you were to me. Oh, nice. Nice. Now, as a renal nurse, you are there technically with the patients. You're offering the patient the service to the patients. There you are. You have to balance. You have to balance because these are the patients who really need you at that time. They don't know what is their future. They don't know what's gonna happen tomorrow. They feel that life is shortened. They feel that there is no hope. For example, there's a patient who once told me that I am starting this dialysis and I have to hand over everything I have. I have to hand over my title to the wife. I have to plan to subdivide the farm and give to my children because I'm not going to live anymore. These are the patients who just lose life. Immediately they see that machine and they see that blood rolling down. So you have to be there for them and empathize for them. Talk to them that this is the way to live, and you will live long. You can do a transplant, and life will continue. And compassionate is really, really important in renal unit, even in the other wards, in the other general nursing. Compassionate is there with us. It is inside you. So handling those patients needs you to balance, despite the heavy work you do. You have to be there, provide moral support, psychological support, smile to them. This smiling to that patient really, really matters. That's why you see me in my videos, I dance with them. Yeah, that is it. And be happy with them.
Yeah, I remember those videos.
Thank you. That's quite very interesting. Very, yeah. Thank you so much, Alice. That is so nice. And of course, now giving them hope and telling them, like, for those who can't be transplanted, they can still continue on dialysis. I know there's a patient in the US who has been on dialysis for over 53 years. So even on dialysis, we tell them there is still life after kidney disease. Thank you so much. I'm handing over to Brother Steve.
All right, thank you, Tabitha.
Okay.
Alice. Now I may pronounce these counties wrong, so please forgive me if I do. But
Steve,
can you hear me?
Yeah.
Okay. So what I said is I may pronounce these counties wrong.
Brother
So
Steve,
forgive me if I do. Can you hear me, Tabitha? Anyway, so you can hear me, Alice, right?
Yeah, I do.
Okay. Brother Moses, you can hear me?
Yes.
Okay. So you've been part of a supporting dialysis expansion in counties like Kisumu, where Brother Moses is, Kapsabet, I may pronounce that wrong, Kericho, and Taita Taveta.
Yes, Taita Taveta.
Taita Taveta. So what impact did that expansion have on patients? When y'all expanded out to those counties, what impact did it have on the patients in those counties?
So thank you, Steve. As earlier I told you that we only had how many centers? We only had 2 in the country, 2 centers providing services for the whole nation. And when the ministry decided that, no, this is now too much, we need these services to be devolved to the other counties near to the community. And my team in Nakuru County, the renal nurses from the Nakuru County Teaching and Referral Hospital, we were pioneers because our hospital was the first to be installed the machines. So the nurses from my unit, that time I want to appreciate our in charge was called Jane. So together with Jane and other nurses, the renal nurses, we were distributed to several countries, to several counties in the country. Those are the few that you've just mentioned. There were many of them. And they were to go there, train the nurses there, how to use the machines, and even start with them dialysis with them, handle with them the patients together until they were able to move now. And I'm telling you, Steve, that impacts to those communities, it has made a lot of changes. People were able to live long, not traveling anymore to Nairobi. They were able to embrace life and even live for long. Access care very fast. And that is very, very recommendable to our country. That was amazing.
Speaking of Jane, is this the Jane right here that says, going down memory lane? Well done, Alice. You are a great team player and advocate of our renal patients. Keep on keeping on.
Thank you.
And then we have Joy, Alice too. She is my favorite nurse. Very dedicated and caring. God bless you, gal.
Amen. Thank you. Thank you.
So, I mean, I'm sure when we think about this, and then Brother Moses, I know he got a question, but me and Brother Moses had this conversation in the past, and he shared with me years ago that many patients out in certain counties had to travel for hours to get to treatment, and some didn't even make it. Some didn't even make it along the way.
Yes, true. That is very true.
By you putting these facilities in these rural counties, it's adding quality of life to many people who are dealing with this disease in Kenya that may not have gotten treatment in the first place and would have pretty much not be here today. Is that what you're saying?
Yes, yes.
Wow.
That's a very, very amazing story. And many people used to travel, let's say like 7 hours from Kilifi County or even Malindi. Those are very, very many hours from those areas to the city where the dialysis centers were available. And even some could die on the road because of potassium. Some could die because of pulmonary edema. They couldn't reach the center at the right time. And even others were not able to even to be diagnosed and find out what was the problem. Even our healthcare workers could not really know that this patient will need dialysis at some point. And these patients could even die at home or even in the hospitals, in the rural areas. And and this is amazing. To have these centers in the counties where these patients are has really saved a lot of people and given another opportunity for people to live again.
One more thing, Brother Moses, before you ask your question. And you know what can be the icing on the cake, Miss Alice, is, put in this education, the Kidney Hub East Africa information in these centers to bring patients to get other information and education with, what they may not be getting now from shows like this to help add value to their life.
Yes. Thank you, Steve.
Yeah. All right, Brother Moses.
Well, Alice.
Yes.
What are some of the biggest challenge nephrology nurses in Kenya face today?
Thank you, Moses. The biggest challenge we face as nephrology nurses is, of course, the shortage of nurses. Yeah, you handle a lot of patients, and we are very few. So that's why sometimes our nurses may not be able to balance between technical and even providing that compassionate and that closeness to these patients. I think the biggest challenge right now is the shortage of nurses, of the renal nurses, not even renal nurses, even the other cadres. There is a lot of shortage. Yeah. If the government can really think of managing the human resource, employing more people, more nurses, more doctors, more specialists, we can really improve the care and the outcomes of our patients.
We had a saying. Oh, go ahead, Brother Moses.
Maybe just to add on, what about environmental factors like protective gear and again, things to do with motivation? Could you just highlight about that also?
Yeah, I want to appreciate my county so much. We really get support from our county. We have never really had much shortage of these PPEs and whatever we require. Our patients have been able to get all these things. But from other counties, I know there could be shortage of these PPEs. There could be issues with the resources, the minimal resources they are allocated. But I want to, at this point of time, I really want to appreciate our county government, because the health, they've really put a lot of effort to ensure that the patients get everything they need. Yeah.
Okay, thank you.
Yeah.
Back to you, Tabitha.
Thank you so much. And even Alice, of course, remuneration is part of the package that people may even require. And as I would like to ask you, Alice, why do you think patient education is such an important part of renal care? Patient education.
Yeah. Thank you so much, Tabi. Patient education is very important. When we educate our renal patients or our kidney disease patients, they will know how to manage themselves. There's so many things they need to know. There's so many things they need to know. Number one, they need to know the diet they are taking, or which type of diet they require to take. How do they take care of themselves? Okay, are they able to come for dialysis, the prescribed time? Okay, we do twice dialysis in Kenya, of which it is way back below, because we need, as per what we read in our books, that we need to do like 3-4 times per week. But now in Kenya, we do 2 times because of the scarce resources. And these patients, if we educate them well, they need to know how to do their diet. They need to know that they need to come to the hospital twice a week, because some can tell you, no, even once a week is okay for me. I can do once. I cannot come twice because I don't have transport. So they really need to know that twice is even minimum for them. They need 3 times. But now, because of the resources, let them come those twice. Many other things that they need to know, that they need to plan also. If the relatives are able to donate the kidney, they need to know that they can be transplanted and they can have another life with a new kidney from a relative or from a loved one. Yeah. And they stop coming to the hospital for dialysis. Now they can live another life, a better life with a new kidney. Yes. Yeah. Education is very important.
Mm-hmm.
Thank you so much. Thank you so much. As you talked about the care, I've also remembered about even how they need to manage their fluids. They are those who don't even pass any urine. And even as we are educating them, we are able now to help them even adhere to the fluids, dialysis, the drugs, all that. Thank you so much.
Yeah.
I would like to hand over to Steve.
Alice, let me ask you one question.
Yes.
Is there, or has anyone introduced, or is there any type of legislation, anything to be put in on changing the requirements for transplant, instead of like just having only family members can do it, that it could be open to anyone? Why has that not been accepted, that anyone could donate instead of just family members? Because some people may not have family members because they may have passed away. Some people, family members may not qualify. So then that leaves them stuck. Why not let anyone who wants to be what we call here an altruistic donor step up to give a transplant to help reduce people that need the kidney?
Yeah, thank you, Steve. We are not yet there, Steve. Right now in Kenya, we do transplant from from close family members. There is a policy right now in the parliament. We are waiting to see what happens if we are able to do if we have those patients with brain dead, and we are able to harvest those kidneys from these patients. We are waiting to see what happens if they can adapt that as a policy. Then those patients who have brain dead in ICU, they can be harvested the kidneys and then help others to be transplanted. Like now, we cannot do transplantation from non-family members. We don't do. We are not yet there. Maybe in future, something like that can come up, and our legislation can adapt that. We are on the road. Yeah.
Wow. Okay. Thank you for answering that. But let me continue. Alice, you are currently pursuing a master's degree in nephrology nursing. What motivated you to continue your studies, and how do you hope it will improve your work?
Thank you, Steve. Yeah, I decided I have to go back to school and advance. I wanted to have more knowledge. I really wanted to have more knowledge on how we can handle these issues. And after that, we can see how we can manage our patients better. We can do research, we can educate others, mentor others, be involved in policy making. Yes, renal is wide. Renal has many pertinent issues to be addressed. Yeah, I can take part in policy makers with other people and decide the way forward for our patients, yeah, and family members. And I'm happy and excited about it.
That's awesome.
Yeah.
Wow. Brother Moses, I hand the mic to you.
Wow. Keep it up, my
Thank
sister.
you.
Yeah.
Thank you.
It's better to get educated rather than to try ignorance.
Yeah.
Yeah. Now, Alice, how has mentorship and teamwork helped shape your career and the growth of dialysis services in Kenya?
Thank you so much. I'm telling you, Moses, without teamwork, you can do nothing alone. Personally, I work with a very strong team. The team at Nakuru County Teaching and Referral Renal Unit is a very strong team, very united team. And we've really tried to mentor the young ones, the upcoming nurses, on renal diseases, on kidney care. Mentoring them is important because we are also aging and we are exiting, and we need to have another cohort who are coming to take over from us, and therefore we will not have a gap. We will not have a succession gap, something like a succession gap where we exit and there's nobody left to take care of our patients. So mentoring others, even through social media, teaching them on the ground. We have schools, we have medical schools rotating in our unit, and we mentor them, we teach them, and in line of their careers, they are able to choose which career I can go. I can go do oncology, I can do renal. That's where they shape their lives also.
Wow.
Yeah.
I mean, that's good that you're thinking along that route about you know, looking for nurses to replace you when you know, so if you move on, it doesn't leave a gap. And unfortunately, here in the United States, I don't think they think in that manner. There's always changeover, shortage of nurses. You know, here you have to have a nurse to open up the unit. If you don't have a nurse, you can't open up the unit. Now, I don't know how that is in Kenya. It's the same way. But here, if there's no nurse to open up, you cannot dialyze any patients.
Yeah, true. Even here, it's the same.
Okay. Okay. All right, Tabitha, you're up.
Yeah, thank you. Alice, what are the key messages you always want patients and family to understand about the kidney disease and the dialysis? The key messages.
Thank you, Tabitha. The key messages I always want our patient to understand is that for the patients, adherence is very important with the family members. That you cannot come for dialysis. You know, our patients, when they come for dialysis, like 2 months or even 5 months, they feel that they are okay. They are fine. They are healed, and they can decide to stop the dialysis and even stay at home. So adherence is very important. We tell them that when you start dialysis, you have to continue. Another thing, they have to adhere to the diet. They need to restrict the fluid. They need to restrict the potassium food, and they need to also exercise. They need also to be active. Now, in our African culture, you know, our patients can become sick and they tell their family members, "Now I'm not going to work anymore. I'm going to stay at home." Yes, because now I am sick, I cannot go to work. Maybe you are a teacher. I cannot go to teach again. But when they live a quality life, they are able to move on with their lives. They're able to be well, they eat well, they do dialysis fine, and they can continue with their careers. It is very important to tell them all those messages, the key messages. Something else is that that dialysis is not the end. Yeah, they need to be hopeful that they will live. They will live long with dialysis. I'm happy to hear that in the US, Tabitha said that there's a 53-year-old man. No, somebody has dialyzed for 53 years. And that is really amazing. That was an output of a good care from people like Steve. Yeah, of course. Good care. That's why they are able to live for long.
Wow. Wow.
Thank you so much, Alice. What was the financial implication of dialysis? The family needs to understand so that apart from hospital insurance supporting the patient, they need money for frequent investigation, for the drugs, or even transport. To you, Brother Steve.
All right. Alice, I want to ask you a two-part question.
Yeah.
My first part is, why is kidney health awareness so important at the community level, not just in hospitals?
Yeah, thank you, Steve. At a community level, those are where we have so many people who are maybe not very literate. They haven't gone to school and they don't understand many things about all these diseases. They cannot understand about hypertension or diabetes. What happens if somebody is not treated about diabetes or hypertension? So it is important for them to know so that they can go to hospital, be diagnosed early. the disease be detected early so that they can get the intervention early, so that they cannot even complicate more. Yeah, we save them from even death. If they complicate, they can die. So it is important because if they get this information, they can be treated early, the disease can be detected early, and they are managed early. Yeah.
Okay. And my second part of my question is, can you share a moment in your career when you felt truly encouraged or fulfilled by the care you gave a patient?
Yes, yes. There are several moments I've encountered in nephrology nursing. For example, there is a day I was just closing the unit and I was leaving home. And a doctor ran coming, telling me there is a very bad patient that was at 6 p.m. in the evening. We don't do night shifts, so we do only day shifts. So she told me we have to go and see this patient and see what we can do. So we went with the doctor to the ward, assessed the patient, and really this patient needed urgent dialysis. The patient had pulmonary edema and even uremic encephalopathy. He was just semi-coma. So I had to rush back to the unit, call my colleague, and opened up the unit, start the plant, bring the patient, get an access for this patient, and even put this patient on the machine and monitor this patient for the first session that day, the second session the following day, the third session, the second week, the twice there, and this patient came up and is still alive, is doing the 9th year in dialysis. And we have saved so many patients who come very, very bad, very, very sick, land in ICU, able to dialyze and come up again and live again. And that is amazing. And they give hope to others, those who come very sick, those who come in sometimes coma from ICU, and they open their eyes and they see you there. Urea is down, the potassium you are able to remove, the fluid you have been able to remove. These patients come up very, very well, and they are able to live another life again. And that is a very, very, very amazing story, and very touching and encouraging.
Thank you for sharing that. Thank you for sharing that. All right, Brother Moses.
Well, 2 minutes to go, seemingly. The next question belongs to Tabitha.
No, Brother Moses, we're at question 11.
Yes. Why is kidney health awareness important at the community level, not just in hospitals?
No, I already asked that question.
Yes. So the next question belongs to Tabitha.
Yes. Thank you so much, Brother Moses. Maybe what message, Alice, do you have for caregivers, patients, and even the young nurses? You can start with any of the three. Thank you.
The message I can give to the caregivers. Are you hearing me?
Yes, I can hear you.
Okay. The message I can give to the caregivers is that let them not tire up. Some caregivers can lose hope and say that this is a burden. It's like we are carrying a burden in a family. And they just sometimes feel like This patient can just die and leave us alone in peace. Yeah, they should not give up. They should just continue taking care of these patients well. They should be able to follow all those health messages we give them. They should be able to know and have information on how to take care of the kidney patients or dialysis patients at home, how to cook for them, how to restrict all these fluids and restrict other food. Yeah. And for the patients, they should follow up whatever we are telling them. They should be able to follow the diet, follow the investigation for monitoring, because they need to be investigated monthly to know how they are doing. They also need to be hopeful in life. For the young nurses, I truly believe that mentoring them is very important, and they need to emulate what we are teaching them. They need to emulate the good education we are teaching them, and come up strong and be better and give better services than even we have done. Yeah.
Thank you so much, Alice, even for that. And again, for caregiver, they need to know that you can delegate care without any regret. You can allow other people to help you manage the patient, and self-care for caregiver is very, very important. And they also need to get a lot of information on the kidney disease as much as they can. And then for the patient, dialysis, drugs, and also adhering to the diet is very, very important. And for our young nurses, we just need to know that you can ask, if you do not understand, ask your mentors, and experience also will teach you something with time. Thank you so much, Alice. Over to you, Brian.
All right. All right. Well, Alice, I got one more question I want to ask you before we close the show. It's kind of a two-part question. What role do you think nurses, patients, and communities should play together in improving kidney care and advocacy? And then my second part, which I will repeat, what message would you like to leave with patients who may be watching you right now in Kenya or East Africa, their caregivers, or any young nurses who decide to go in nephrology watching this right now? What message would you like to leave with them today? That's the second part. The first part, again, is what role do you think nurses, patients, and communities should play together in improving kidney care and advocacy?
Thank you, Steve, for the question. The role of the nurse. Let us start with the role of the nurse. The role of the nurse is it is important that we are able to advocate, become good advocate, teach the community on the causes of the kidney disease, like hypertension, diabetes, the other diseases like glomerulonephritis. They need to seek treatment before it is too bad and it causes kidney failure, and then they go to dialysis. So our role, really, we need to escalate the issue of outreach to the community for them to have that information. For the patients, as Tabitha said, that adherence is important, and to medication, to dialysis, to diet, all those things. Then to the community. The community need to have this information and seek treatment early. They don't need to stay. Yeah, in our African community, especially the men, they are really affected by the kidney disease and they are the majority on the dialysis. When the men become sick in our community, they feel they are strong. So they tend not to go to the hospital very fast. They tell you, let me see how it goes tomorrow. Let me see how it goes. Then they take painkillers. They take the diclofenac. They take those paracetamol. They take the Brufen. And the disease continue damaging them. Right now, the NSAIDs, the painkillers are causing the kidney disease. So I should tell the community that they should not self-medicate themselves. They don't need to go to the chemist and ask for medication for themselves. They need to go to the hospital. In case of any problem, don't go to the chemist. Go to the hospital and be checked and be prescribed the right drug. Self-medication is not good.
Wow.
Yeah.
Wow. Thank you for sharing that. Before we go, Brother Moses, do you have any follow-up questions? Tabitha, anybody, y'all have any follow-up questions before we
oh yes,
end the show?
oh yes. This goes to maybe both Tabitha and Alice. Given that SHA is categorized in three concepts. So concept number one is primary health care. That includes education, preventive measures, and so forth. Are there work in progress where kidney disease is incorporated in that primary care? Because SHA tells us primary care is being taken by SHA. The government tells us that primary health care is completely covered by SHA. That is why when you go to level 3 hospital, treatment is completely free, but they are short of staff, diagnostic equipment, and so forth. So basically the question is kidney disease included just like HIV or mother to baby care, something like that?
Maybe I can start. Ideally, if it really has to work very, very well, the government is supposed to support the what you call level 3 hospital. I think the health centers, they should even be having a laboratory. A nephrology nurse should also be posted there, and even a nephrology doctor. Even if a nephrology doctor will not be there, a nephrology nurse needs to be there. A well-equipped laboratory and provision of equipment and the nurses, so that whoever comes there and we are managing hypertension, we can do our monthly lab and we see how badly is the patient deteriorating, how are the kidney functions. And once you as a nephrology nurse, you're able to interpret those results, the patients can be referred either to a level 4 or even a level 5, where they just need to get the next management, maybe before they can even start the dialysis, where maybe they need even to see a nephrology doctor. So maybe we may not be there, but ideally that's where we are supposed to be. Over to you, Alice.
Thank you, Tabitha, for that. Yeah, that is a good insight on that. I think SHA is still on its way there, and more amendments are being done. Their policymakers, they're still working on how to amend and make these services better, as you have said. And I think we just give the government time to see that all those things are incorporated. But I know chronic diseases are included in the primary care, but in these level 3 hospitals, level 2, we don't have equipment, and even those specialists who are able to manage these patients well at the level 3, 2 there. Yeah. So I think we are on the road to there. Yes.
Thank you so much. I'm grateful for you, Alice, making it over this show. And actually, you kept time. Thank you so much. And keep it up. God bless you.
Thank you so much. I was really honored to be part of the team, to participate in the Kidney Hub East Africa. And you guys are doing an amazing job. May God bless you. I'll be coming in. Yeah, when I find time, we should be educating our patients more on the kidney
Actually,
disease.
I forget that part. We still hope to have you time and again. Steve will talk about it. Yeah.
Yes, absolutely, Alice. We hope to have you back, reoccurring to help us educate and, deliver information to kidney patients, East Africa and abroad. Do you have any final words before we end the show, Alice?
Yeah. Thank you. I want to say thank you for our viewers who are able to join. People confuse the time. Many joined at 1. That was the US time, and our time was supposed to be at 8 p.m. So many missed up on the time. But next time we shall give them notice early, and probably we will have more viewers and audience. Otherwise, I want to a big thank you to Steve, Tabitha, Moses for everything and for inviting me to be here today. Truly grateful.
Yeah, Alice, you're right. Unfortunately, I think this was the last minute to get you on, and so we didn't really have enough time to really promote the show like we usually do. But we're definitely going to be more better in scheduling the guests ahead of time, so we have time to promote the program to attract more people instead of the last minute. But we want to thank everyone for joining us today who's watching from East Africa, especially Kenya, and the people who came to support you, Alice today on Kidney Hub East Africa. Also want to give a big thank you to our wonderful co-host, Moses Kennedy, aka the Kidney Ambassador, and renal nurse specialist, Tabitha Matekwa. And again, another appreciation to our guests, special appreciation to our guests, Alice too, for sharing her time, her knowledge, and insight with us. And we hope this conversation has encouraged, informed, and inspired you in your kidney health journey. Remember, kidney awareness starts with education, support, and action. Please remember to like, comment, share, and follow us on Steve the Kidney Nurse YouTube channel, Steve the Kidney Nurse Facebook page, and the FIGO Initiative Facebook page for more kidney awareness, education, and survivor stories. Until next time, this is Steve the Kidney Nurse saying stay informed, stay encouraged, and stay healthy. Tabitha, thank you so much. Alice, again, thank you so much for coming. And Brother Moses, it's always a pleasure. We see you next week, same time, same channel. And Alice, are these good days for you? Sunday evenings?
Yes, we shall be planning.
Oh, okay. And hold on. Let me just give a shout out. And man, you must have been, thinking about me, because I was going to reach out to you. We have Richard Knight here, past president, board member of one of the largest kidney disease education, patient education in the United States. That's the AAKP, American Association of Kidney Patients. Richard Knight, thank you for joining. And I was going to reach out to you because I want to bring you on the panel to talk about patient blackball in the United States. And Moses, Richard Knight, he says Moses Kennedy is on it. Again, he's, like I said, past president of the AAKP that you see here in the United States and a lot of their promotions. So I'd definitely be reaching out to you, Richard. Thank you for joining. But again, everyone, thank you so much for joining. And again, I want to say stay informed, stay encouraged, and stay healthy. Alice, Brother Moses, Tabitha, we'll see you soon. And everyone, thank you so much for joining the show. All right, we see you next week, okay?
Thank you.
All right, thank you, everyone.
Thank you.